Good morning. We are continuing our conversation about safety and COVID-19 in construction. And today we've got with us Lisa Capicik, again returning, and we have added Nichole Ivers. And I'm going to let you guys do a little introduction. And again, Lisa, if I could start with you and give us a little introduction of who you are.
Sure. Thank you, Pam. So my name is Lisa Capicik. I've been in the construction industry about 31 years now. Kind of run the gamut between industrial hygiene, moving into construction, tall buildings, working on some healthcare projects right now. Just finished up a major hospital in the Atlanta area. Interesting enough, just now seeing COVID patients and moving on to Children's Hospital in the area.
Yeah, that is pretty fantastic that I've been hearing about, Piedmont on the news and so forth, that it's pretty interesting that we're part of that.
Right,
okay.
It's fantastic. We finished almost 5 months early, and they pushed up the dates just with the pandemic on populating that part of the hospital. So we're excited for them to be able to move in early and treat those that need it most.
That's awesome. Okay, quick introduction, Nichole here.
Thanks, Pam. I'm Nichole Ivers. I'm the Corporate Health, Safety, and Environmental Director for Batson-Cook Construction here in Atlanta in the Southeast. I have been in construction for about 20 years. Spent most of my time in the Michigan area, the Southeast, and overseas, working in the Middle East for many years, and just returned here about 1.5 years ago, back to the U.S. market. I'm an industrial hygienist as well as focusing on safety, so that's a particular interest with this COVID pandemic going on right now.
So before we get started, I think I mentioned this a little bit last time, but just let's do a little shout out to the women in construction safety out there. This has been just a huge pleasure for me personally, given that when I started, and I don't even want to count the years, but I'll just go ahead and throw it out there, 1980 is when I started as a construction safety person, and there were literally no women in the field in the field of safety at all. There were zero, and the change has been real exciting. So just a real quick shout out to all of you out there and doing remarkable work. So let me go here. Let's go to Lisa. Talk again. You talked a little bit about your challenges last time, and with things evolving, has anything changed on the challenges you're facing with managing COVID-19 or in the methods you're using?
I think the challenges have gotten a little bit easier, I think, with the consistency of messaging, both from CDC, who a lot of the local governments, I think, have done a good job kind of managing, at least in the areas that I'm covering, managing the messaging and the importance of following a lot of the guidelines. I think we've probably, from a job site perspective, I think they're from a true respect for what's going on and for the virus. I think we've got a lot of buy-in, which is good to see. Probably faster, than a lot of the typical OSHA regulations that come out, and it takes years really for people to start to buy in and get used to change of habits. This one has been pretty fast, and it's been pretty cool to see some of the ingenuity and the rapid response people have in adjusting their work styles, work locations. Habits are hard to change, in groups of people getting together to solve problems in the field. But I think overall, making sure people wear face coverings when working closer to 6 feet, finding new ways to do orientations and to do safety meetings and to continue that continuity of messaging has been really fantastic. And it's taken all the contractors out there and subcontractor markets to participate in this new style. So I think it's gotten a little bit easier. There's still the 15% maybe that are non-believers, but they have been, I think overall, they've been respectful of, okay, these are the rules and I need to follow it. So it's been pretty good over the last couple weeks.
If I could follow up for just a second on that, the 15% non-believers, most people adapting to this, and I want to do a follow-up podcast later, maybe next week, on risk perception and risk tolerance in the era of COVID-19. And so I'm making the assumption here that maybe people see the risk more clearly or more acutely than they see the risks for fall exposure and arc flash and all of the other things. Would you say that's a true statement?
Absolutely. I think that's very much a true statement. And, the more you can find some opportunities to relate, and I think, those are folks that haven't had anybody impacted or seen anybody impacted or heard of anybody that's been impacted by the virus. So I think what I'm seeing from the majority of folks is there are enough scenarios and individual impacts going on where they can find that relatability, which is, even if it's my mother's brother's wife,
Right.
That has been impacted, or somebody in their work environment, which changes the tune immediately, typically.
Interesting. Okay, Nichole, how about you? What are the challenges and how are things going? Are they getting better or staying the same?
I definitely agree with Lisa that I think we're getting into a good routine with the protective measures that we've put in place. Things happened pretty fast where we went from, the beginning of this and just trying to figure out some hand washing and basic hygiene capabilities on site to doing temperature monitoring across all of our job sites and face coverings and face shields if you're that 6 foot distance, which in construction, there are tasks that you just can't physically do by yourself and you have to be close to another person. So we figured out ways to do that as safely as possible. I think overall it's a good example of social norm and how everybody doing a certain thing makes it easier to implement on site. The majority of our people on site are taking this very seriously, and they're willing to wear the face coverings without question. They're going through the process of the temperature screening, and they're staying home and they're being open about not feeling well, calling in and not coming into work. So yeah, we've had a very quick adaptation to these new preventive measures, much faster than what we have in traditional safety over the years.
All right, so going back here to Lisa for a minute, we are in, and of course, not all of your work, either one of you is just in Georgia, but we are in Georgia getting ready to do some relaxing of the, stay-at-home requirements, social distancing and whatever, the opening up some of the hair salons, etc. Does that change anything for you or for the perception out there in the workforce?
Right now, for us, as far as a mode of business, it does not change anything. I certainly, as with Nichole, we've got multi-state operations, so we need to continue to keep the awareness heightened, keep the respect for the virus there. I think that's going to continue to get a little bit harder for us in the workplace as things start relaxing. Certainly the next 3 to 4 weeks will be telling, because I think people, it is a little bit stressful, you know, to maintain that heightened awareness, but also knowing that at some point it's going to be relaxed. And as safety and health professionals, I think that provides a unique challenge for us, knowing that it may, you know, could very well not be the end of what we see. It could be in the next 6 weeks, we see another spike and have to, you know, readjust and, you know, tighten the reins a little bit, and tighten our controls a little bit, whether it's go back to where we are right now, or, you know, maybe we need to add some other control measures out on the project. But, you know, I think as far as we need to impress upon, you know, the certain populations, the legitimacy of what's going on and the respect for what's going on. Because we, you know, this won't be the last time we see something like this, and it could very well be only a brief pause. But it adds certain challenges that states are relaxing, counties and cities are starting to relax some things. And it will get harder to control those on the job. But I think as long as we maintain that consistency across the board for, you know, Brasfield and Gorrie, or for any job site in any company out there, it adds to that continuity that, yes, we need to still keep doing what we're doing and see where it goes.
Nichole, any thoughts on that, on the relaxing?
Yeah, I mean, I think we have to be prepared that we could see more potential exposures being reported. We don't have any control over what people do on their own personal time outside of work. You know, we talk a lot about ways that they can reduce their exposures outside of work. And I think a lot of them are respecting that right now, considering more measures have been taken. But once those are lifted, we have very little control over where those people go and who they interact with. So I think that we just maintain the diligence on screening and communication and continuing to keep that urgency up in these measures. But I agree with more potential exposures.
Absolutely. I'd like to go back to the risk perception for just a minute and ask you, what are you seeing out there regarding perceptions, fear levels, I guess is what I'm getting at, is what are the, is there a fear level from the workers to do what they're doing, or do you see less of that? Lisa?
There's you know, percentage of the population that certainly does have a fear level, and in some cases, you know, on the Piedmont project, the fact that they have moved some patients into the new tower, and we are still doing work in some of those areas, not in those patient floors, but, you know, I think again that helps heighten the awareness in a good way in most cases. But there are a few folks that, you know, certainly have a lot of concern working in that environment. You know, if they work for us, they certainly have the choice if we're able to transfer them to another job if that fear level is too much for them. But at the same time, again, you know, we have you know, that's a very small percentage that fall on that extremely fearful side across the board. And then there's the other side of that spectrum where there's some folks that, you know, don't have any fear level. So, and really may not give legitimacy to COVID-19. So, you know, I think balancing those two and maintaining, you know, healthy respect, but not, you know, overly fearful is what we work with those two groups with. And then that main group that's doing, you know, the 80% of work on the job, I think, you know, I think it's a it's a workable solution for them, and it hasn't. Once we got over the hump, the first 2 weeks of trying to figure out how do we continue to do our work safely in this environment, with this scenario, and then we've just moved on, quite honestly, and it's it's just a new way of doing work for us.
What are you seeing the same, Nichole? And is there any difference between maybe the fear level on the management side versus the worker side, or what are you seeing?
I think that the fear that I'm seeing is not so much fear for themselves being sick, but fear of taking it home to their families, fear of losing their job or having a project shut down. I really have not seen a lot of people expressing fear that they'll get sick themselves. They don't want to take it home. So they're very concerned about what they're being exposed to on the job. What do they do when they go back home to their families? Do they need to change their clothes? Do they need to wash their boots? And really just, the way we've tried to overcome that is constant communications. We do a weekly address from our CEO to all of our workforce, and focusing on our field operations staff. Just reinforcing a lot of the procedures that we've put in place. We recently had an interview with a doctor with one-on-one with one of our levels of management, trying to dispel some of the rumors and help people to understand the reality of the virus and what they can do and what they should be doing. So I think that it's just communication and trying to reinforce that, to reduce the fear. There is definitely fear there.
How about if you give me a little more detail on what are some of the misperceptions, and what are you actually recommending and telling folks for how to reduce their taking the potential exposure home to their family? Nichole?
I think one of the biggest areas of confusion is just how the virus can be transmitted. Whether it's something that they touch or whether it's something that they can breathe in. In the beginning, we had a lot of concern about being exposed through multiple layers of people. So somebody may have worked with somebody whose mother-in-law was just tested positive. So a lot of those fears of, I walked past this person in the office, and that was in the beginning. That was the kind of level of thinking about how you do it, to now, this many weeks later, having a little bit better understanding of what exposure means and prolonged and close contact. So I think that was probably the biggest misunderstanding, is just how it can be transmitted and what we were doing. How could they protect themselves?
Lisa, you have any follow up on that, on what kind of specific information that you're needing to give folks?
No, I think, Nichole hit it on the spot. The first couple of weeks was really about finding the right messaging and the right folks to deliver the messaging on transmission, and, how do those scenarios work? We've had, the exact same scenarios where, how do I get it? How, if my brother's wife was working in a plant and, it was in there, what does that do for me? I saw them 3 weeks ago. And that's where you see, at least the first couple of weeks, that's where you saw a big spike in, kind of the panic in employees. Not, they were fine before in the work that they were doing, but then somewhere in their population outside of work, they are hearing of some folks that may have been around somebody else that was diagnosed. So dispelling those, we, just like Nichole, have been fortunate to work with a infectious disease doctor at UAB, who's been on our planning board, that has really helped roll out some of the policies and information to dispel some of the myths. And specifically at Piedmont, we were fortunate to have our chief medical officer and our CEO come in and give a presentation to all of the project leadership, including subcontractors and tiered subs, to talk about specifics and answer any specific questions on, transmission and what does it mean when patients, if and when patients are moved in, what does that do for, for the folks that are working there? If you're working on the 4th floor and somebody's on the 6th floor, what does that mean? If I move up to the 9th floor, do I have any higher risk? Or if I'm riding in the elevator, with or in the same elevator bank, but not in the same elevator, do I have a risk if a patient's being moved on to a trauma elevator and we're on the elevator next to it? What does that do? So, again, it's interesting that people can be somewhat dismissive about the risks until, a situation arises, whether it's a family member that's been in contact with somebody, or maybe such as Piedmont, when they might start moving patients in, then the awareness level is spikes. And thankfully, we've had some really great owner conversations that have helped distribute information extremely quickly, to the masses, so that we avoid really some mass confusion, and rumors.
By the way, Lilly has decided that she wants to have her own channel, and so we might be working on that. I don't want to ask, and I don't want you to answer about specific exposures or illnesses within your own company, but I would like to hear what you are hearing out in the general construction community about the level of exposure that we're hearing out there. Nichole, you want to respond to that?
Sure. I mean, I haven't really known of too many specific cases with other contractors out there and what they did, but I know that each exposure or illness has to be somewhat evaluated for what the potential is for that exposure. So I don't think that a one size fits all for every type of exposure or illness. I think that most of the companies are taking that same type of approach and looking at areas for evaluating the type of exposure and that person may have come into contact with and what areas of the project. So I think that everybody's prepared to evaluate those and make decisions based on that, whether it's anything cleaning a job site to shutting down job sites. I don't think it's one answer.
And this is not data, when we just talk about the anecdotal, but the general impression I'm getting is we are not seeing community spread of any magnitude in construction. I hope that's true. Again, this is not data. This is all just anecdotal. But if that turns out to be the case, I'm pretty impressed that we must be doing a decent job out there to have this much construction going on and not have a great deal of spread. Lisa, thoughts on that?
I agree with you, Pam. I think it's quite remarkable, and probably for a lot of reasons, that I think construction companies, moreover, have really done a good job trying to wrap their arms around this challenge pretty quickly and come up with programs and policies and information for the employees, and a mad scramble for PPE as the hospitals and other industries have had to do, and being so unique, I think the majority of the folks were quick to adapt. but we have not seen that, you know, from an exposure standpoint to, you know, there have been, and I've heard of a couple cases, in general, and I think it certainly has maybe brought to light smaller groups, and typically it's happened where it's been a smaller group that travels. It could be, you know, some maintenance folks, you know, that go work on equipment and that, and they're riding in the same truck, or delivery drivers delivering equipment and material that usually are two to three people per truck. And those are the situations where they might have had a family member, you know, and notified us through a subcontractor, where they've had to go back and really evaluate, you know, their means and methods. And it's challenged, I think, the contractors out there to really understand their, you know, their reach and their responsibilities. So it's not just with their own employees, it's how are they managing the folks that are coming from different areas, whether it's material, maintenance, equipment coming in, subcontractors coming in, inspectors coming in. You know, how are we managing those folks and providing the best possible environment? And if they're not really aware, how are we making sure that they're following the same guidelines that we have? Because not every job site is doing temperature testing like Nichole's. Not every job site, you know, is 100% face coverings. You know, that may be 100% face coverings within 6 foot. So it's challenged, I think, our whole market to wrap their arms around, you know, their own work scope and manage it effectively.
Sorry, Nichole, Lilly is once again wanting to be involved here. Obviously, we have had testing be an issue countrywide in availability of testing. And so I know it's been fairly minimal so far, but do we anticipate, you mentioned temperature testing, do we anticipate being able to add a higher level of testing for potential exposures in construction? Either one of you want to comment on that? Nichole?
Sure. Yeah, I mean, this is not something that we actually anticipated. I would say at the beginning of this, we felt in the early stages that if somebody went off symptoms, that they would easily be able to test, and that would confirm whether or not they could come back to the job site. And I think that changed pretty quickly early on when we realized that people just weren't able to get the tests. So we had to change our approach and decide, you know, how we could monitor those symptoms and how long they needed to be symptom-free period of time before having them come back to work. That made it a little bit more difficult in the decision-making process. It would have been nice to be able to have a test, and especially now that we have more availability of tests, but asymptomatic people are still not able to get the test. So if we have an exposure, we can't get that person tested very easily, if at all, and that would be helpful in making sure that people can come back to work. You know, nobody wants to be quarantined, nobody wants to be isolated, everybody wants to continue working. So that would definitely make it easier on us if there was an availability of tests, especially for asymptomatic, to just confirm and also to give our workforce a peace of mind that somebody that is either showing symptoms or had been showing symptoms can get a test and have that confirmation.
I think that would give all of us across the country a little more peace of mind if we see testing ramp up like we hope that it will. I know that you and Nichole, Lisa, and a number of other safety professionals here in the Southeast are regularly meeting and talking and sharing best practices and so forth. Is there any potential, or have you given any thought to doing white paper or something along those lines to that could be published at some point?
That is a fantastic idea. Honestly, I have not really, that hasn't entered my mind, only because I think we've been fast and furious trying to implement some best practices, and I think to some degree we all want to maintain some consistency, because I think between contractors, general contractors, the more we can be consistent, the better success that we have, no matter what the effort is on projects. So I think that's a fantastic idea, and certainly am open to it.
Nichole, you open to participating in that?
Yeah, absolutely.
So let's put our heads together afterwards, and if we could maybe start working towards that, it would be a great boon. Nichole, have you got anything else you want to share on what's working for you, or problems you're having?
I think that just the things that we've implemented, it's been good to see consistency across the entire industry. So there's been so much sharing that when somebody has an idea, we share that across the board. There's been a lot of trouble with the infrared thermometer, for example. That's been troubleshooting and talking about better ways to take these temperatures, and setting up booths so that the screener can be behind plexiglass shields, protecting our screeners from multiple people coming up. How to calibrate those thermometers. The slightest little bit of wind or cold in the morning can completely throw those off. But you have to really be able to troubleshoot those and calibrate appropriately when you're out in the field. So that's taken some learning. Going through different levels of PPE. Some people want full N95 filter-in safe piece respirators. Other people don't want to use the buff covering because that's too warm, but wearing a respirator is going to be almost impossible for people to work in all day long. So that's been a lot of learning for us as well, and having the opportunity to communicate about respirators. I never thought that I would see in a million years on the nightly news health, safety, PPE, N95 used on a daily basis. That's been a positive aspect of it, is to get that information out there and help us to teach these things that we've been trying to reinforce for years.
That is fascinating how those terms that have been just part of our daily vocabulary are now on the nightly news every night. So, there were two things that strike me about that. One is, Nichole just mentioned it's virtually impossible for folks to wear, respiratory protection all day long. And yet we in safety have, required workers to do exactly that. Sometimes, not with either of your companies, but sometimes to the detriment of the employee, when we could have been using better ventilation or different products or so forth. And I think that now that we have a lot of folks, including supervisors and safety people, going around wearing respiratory protection all day long, they might be having a different viewpoint on that. Any thoughts to that? And Lisa, also, what are you seeing for availability of PPE? Is it getting any better yet?
I think it has gotten a lot better. I saw last week, bulk shipments started to come into suppliers. We were getting calls from suppliers that just received shipments or knew that shipments were coming in, whether it was for surgical masks, for hand sanitizer, for respirators in general. So we are seeing a big release of that, knowing that the hospitals have, at least around this market, have what they need So that availability has been good over the last, 10 to 12 days. So we've been able to stock up for at least for the immediate future over the next, 4 weeks, I would say. The only challenge I really see, or that I'm starting to see now, is, it's been great. Like Nichole said, both people are familiar with, a little bit more familiar with what we do, and personal protective equipment and respiratory protection. But I see a blurred line now being created in respiratory protection, and, what is good for maybe protection from silica, and how we need to wear respirators, and what's good for general protection for a situation that we're in now, where any face covering is accepted for the most part.
What are your thoughts? I'm a little shocked, both of you, well qualified to answer this, but I realize that we've had a shortage of, N95s or good respiratory protection, but this whole public thing about, a red bandana is just fine. What are your thoughts about that? Especially, is that what you're alluding to?
Yes, absolutely. We've already had, some folks that have forgotten what they're supposed to wear when, so either doing some interior demolition of concrete and that, wearing the red bandana per se, and having to go through those discussions again and distinguish the difference, between the work that they're doing and then what they're exposed to versus, the general face covering conversation for the COVID-19 protection and the recommendations for that. So I see some challenges. Like I said, I fully expect to be addressing that gray area now for the next couple of years. And what's the difference? Hey, I could wear this bandana, over there in the last job we worked on. Why are you making me change it now? Not really understanding that their exposure is different. So it's a different particulates or issues.
Nichole, how about you on PPE availability and issues?
Yeah, I think the availability is there now. I'm not completely confident in some of the alternatives that have been approved, like the KN95, just because I've been seeing a lot of variation in those and
Right.
a lot of counterfeit masks coming in. So it really is giving us the opportunity to reinforce Table 1 of the silica rule and really reinforce engineering control before we go to the respirators, just because there has been such a demand for them, and we donated a lot of our respirators to the hospital so that they could be protected, and we implemented whatever engineering controls we could, which was again a good education process for some of those tasks. But I think the difficulty in the respirators and face coverings, understanding that in the past our respirators were protecting us from things on the outside, and now we have a dual purpose. We're trying to protect other people from us. So an N95 mask with an exhalation valve on it is not providing the same purpose as a face covering, one without an exhalation valve. If that's your intention, it will protect the person from silica dust. So yeah, even though there's a lot of talk and opportunities for educating, it's very confusing.
Yes, the difference between exposure control from particles like silica to the protecting others is a huge issue. And the other thing I see is folks not understanding basic infection control processes. You both obviously highly involved in healthcare and are familiar with that, but people that think that by wearing this mask and it's going to protect me, and then they go out and they wear the mask in public. If the outside of the mask is contaminated, they take it off and they touch it all over, you know, along with same thing with gloves and proper donning and doffing. We seem to have a ways to go there. Thoughts?
Right. I would agree. And I certainly have passed along some of these great cross-contamination videos that have come up, you know, that you can find on YouTube now. They've done an amazing job illustrating cross-contamination and how that works and how easy it is. So, you know, I've seen folks, you know, with, you know, that will, you know, out fueling, you know, their vehicle, and then once they're finished, taking their gloves off and putting them in their car to use at the next stop, which is probably the grocery store down the street, and then putting the gloves back on. So it is really interesting to watch habits and to watch folks that don't, you know, that maybe don't quite understand it yet. But the videos that are out there have been amazing, and I've shared those to the degree that we can help educate other folks, and I think they've been very helpful.
Yeah. You think that this is potentially going to improve our public health just by additional knowledge? Nichole, any thoughts?
No, go ahead.
Yeah, I mean, it definitely can't hurt. I mean, I think that a lot of these, the levels of hygiene we should have been doing on sites anyway. I mean, we've, you know, the construction site is a hard place to keep clean, but I think that adding these additional sinks and opportunities for hand washing is only positive, and it's going to help with the spread of any kind of illness.
You want to follow up on that, Lisa? Because
no, I to Nicole's point, I think it's been a great exercise for us. You know, certainly we weren't thinking that the first 2 weeks, but I think really it's been a great exercise as we reflect on what we've been able to accomplish in such a short time, and really how easy it is for the small things, I think, that make a big difference in somebody's experience on a job site. You know, if we as contractors, general contractors, can improve that experience for employees, you know, it's going to do nothing but reap, you know, exponential rewards on the job site. Something as simple as adding hand washing sinks, either, you know, from either not having any or maybe having a go. You know, there are sometimes we can only have, you know, some Gojos or hand sanitizer out there on remote parts of a project site, but more often than not, we're not you know, we haven't taken the easy route to find an irrigation line and tap into that for some hand washing sinks out somewhere, or find some, you know, water storage tanks that we can run some sinks off of there, and that requires very little maintenance. So I think we've found some easy opportunities to improve experiences for folks, and really to improve hygiene overall on the job, where we used to take the easy answer, which was, no, that's too hard, we can't do it, you know, just deal with it. It's the way it's always been. This has been a good, I think, eye-opener for us, that it doesn't have to be how it's always been.
Yeah, and I really do believe that we have the potential for decreasing a lot of illness in the general public. And just going back to the construction, I credit Lisa for being one of the folks here in the Southeast that pushed hand washing and having portable hand washing or some sort of sinks back when it was not done. I mean, it was not common out there, and the resistance when folks saying, well, what do you need that for? You know, well, here's some hand sanitizer. And that's something that is, because I have a interest in the historical side of safety, I'm always amazed when I read the OSHA regulations, and I know you guys know this, but there might be folks that don't, that the way the OSHA regulations were written just for drinking water was, there's a statement in there in subpart D that talks about the common cup is prohibited. And think about that for a minute. Our OSHA regulations are suggesting that you don't have a dipper to go into a barrel to drink water out of, because that's where we came from. And that's where my father talks about that as being the way that they did drinking water, was basically having an open barrel and a common cup. So we in construction have kind of lagged in general sanitation, I think, for a long time, and it's been getting much better in the past few years, but this might actually help boost that. You know, if nothing else, people are washing their hands, for crying out loud. And what has been the extent, I don't think we know, of the amount of illness that's generated from construction projects where there was no hand washing ability, just setting COVID-19 to the side, how much influenza and stomach ailments and diarrhea and so forth have come from that. So maybe more of the information than we wanted.
The industrial hygiene side, industrial hygiene started with contamination because people just weren't washing their hands, which is where the hygiene term came from. So it's almost like we're back at a grassroots stage of hygiene, where we're just trying to practice basic hygienic methods to prevent the transmission of this.
That's fantastic. That's fantastic. And why am I looking at your dog again?
Sorry.
No, it's good. It's good. It's good. I know that's on your phone. We love dogs here, all three of us, right?
Yep.
Lisa, we're approaching that hour time. Do you have anything in closing or anything else you want to add?
I've enjoyed really the collaboration side of this, you know, being able to call, you know, my peers from Nichole to Adrian to Hillary and Jenny and just really the run of folks that, you know, we're all in this together. You know, I don't think any one of us thinks that we have the answer to all of it. And the fact that people have been so willing to share in not just this effort, but I think, again, it opens the doors to collaborating on so many other things. We in the past have not been an industry that was willing to share very much. And I think this has kind of accelerated that opportunity to really, none of this is proprietary. You know, we're all in it, you know, for the greater good, and, you know, to help the entire community, construction community. You know, we've got a lot of great things to build. We've built a lot of great things, and I look forward to what we have moving forward. So I just want to thank everybody for really being a part of a bigger plan.
Awesome. Nichole.
Yeah, I echo the same thing. It's been a learning process along the way, and a lot of decisions that you're making, you know, you don't necessarily know that they're the right decisions. You know, you're just going based on you know, what you think is the right thing to do. And I think that people in our field, as well as, you know, a lot of the leadership and management of construction companies in this area, they've been put into on the spot to make some really difficult choices. And that, you know, that's what we live with every day in safety, is that there are a lot of different difficult choices that you have to make and decisions. And I think that people have really put employees' health and safety at the forefront dealing with this pandemic.
Awesome. Well, I very much appreciate that. I want to echo the pleasure and the collaboration amongst everyone. And I'm going to push for that white paper and offer my help and if I can, in helping make that happen. And thank you very much. And we'll try to do this again soon. So please stay safe and flatten the curve out there. And thank you, ladies.
Thank you.
Thank you.
Okay.